Hello, dear viewers. Welcome to Moderna College. In our Science Updates section, we bring you the latest scientific news, groundbreaking research, international conferences, major events in the world of science and technology, and the most important innovations shaping our future. If you want to stay informed about the latest developments in science, subscribe to our channel and join our growing community.
Hello and welcome to our dear viewers of Moderna College. First of all, we would like to sincerely thank you for following our programs and supporting the spread of scientific knowledge. Your continued support motivates us to bring you the latest discoveries and the most reliable research from around the world. In today's scientific report, we examine the findings of a new study suggesting that the factor most strongly associated with suicidal thoughts in people experiencing psychosis is not simply the presence of hallucinations or delusions, but the emotional distress they cause, combined with anxiety and a profound sense of psychological entrapment. The study, published in the prestigious Journal of Affective Disorders, examined 219 adults living with non-affective psychosis who had experienced suicidal thoughts or suicidal behaviours during the previous 3 months. The researchers sought to identify the psychological mechanisms that increase the severity of suicidal ideation. Psychosis is a serious mental health condition in which a person may lose touch with reality. Hallucinations such as hearing voices or seeing things that are not present, and delusions are among its most common symptoms. For many years, clinicians assumed that the severity of these symptoms directly determined a person's risk of suicide. However, this new research presents a different perspective. The study was led by Professor Patricia Gooding and her colleagues at the University of Manchester. Their work was based on modern psychological theories of suicide, which suggest that the strongest drivers of suicidal thinking are feelings of defeat, hopelessness, and being trapped in a situation with no apparent escape. To investigate these ideas, the research team assessed 219 adults receiving treatment through mental health services in the United Kingdom. Most of the individuals were male, and many were unemployed or unable to work because of their health conditions. The researchers used structured clinical interviews and validated psychological questionnaires to evaluate the severity of hallucinations and delusions, levels of anxiety, feelings of defeat and entrapment, hopelessness, and the intensity of suicidal thoughts. The findings revealed a clear psychological pathway. The greater the emotional distress caused by hallucinations and delusions, the higher the individual's anxiety levels became. Increased anxiety, in turn, intensified feelings of being trapped, and this sense of entrapment was strongly associated with more severe suicidal thoughts. In other words, it was not simply hearing voices or experiencing delusions that predicted suicidal thinking. Rather, it was the emotional suffering created by those experiences that played the decisive role. The researchers also found that this relationship works in both directions. High levels of anxiety can increase the emotional distress caused by psychotic experiences, while greater distress further intensifies anxiety. Together, these factors create a self-reinforcing cycle that ultimately leads to a powerful feeling of psychological entrapment, significantly increasing the risk of suicidal ideation. One of the study's most important findings was that the severity of hallucinations and delusions alone did not significantly predict suicidal thoughts. Instead, what mattered most was how emotionally distressing those experiences were for the individual. This represents an important shift in psychiatric thinking. Traditionally, treatment has focused primarily on reducing the frequency or intensity of hallucinations through medication. However, these findings suggest that even if a person continues to experience hallucinations, reducing the emotional suffering associated with those experiences may substantially lower the risk of suicidal thinking. According to the researchers, future mental health interventions should pay greater attention to patients' subjective emotional experiences rather than focusing exclusively on visible psychiatric symptoms. Helping individuals reduce anxiety and overcome the overwhelming feeling of being psychologically trapped may become a key strategy in suicide prevention. The authors also acknowledged several limitations. Because the study used a cross-sectional design, all data were collected at a single point in time, making it impossible to establish definite cause and effect relationships. In addition, anxiety was measured using a limited clinical indicator rather than a comprehensive anxiety assessment. The researchers recommend that future studies follow individuals over longer periods and use more detailed psychological measurements. Overall, this research highlights the importance of understanding the emotional experiences of people living with psychosis. By reducing anxiety, emotional distress, and feelings of entrapment, mental health professionals may be able to significantly reduce the risk of suicidal ideation and improve long-term psychological well-being. Thank you for watching. If you found this scientific report informative, please like this video, share it with your friends, and subscribe to the Moderna College channel. Don't forget to turn on notifications so you never miss our latest videos. At Moderna College, we bring you the latest scientific news, cutting-edge research, and important discoveries in psychology, neuroscience, cognitive science, medicine, and many other fields, presented in a clear, reliable, and easy-to-understand format. Until our next scientific report, stay healthy, stay curious, and keep learning.